Okay.
Okay, I have the question for the week if you all would like me to read it.
Yes, please
Sure.
do.
This chapter explores the orientation stage in more detail. Compare it to what you read last week. What are some of the differences you noted? Corey describes groups in more of a general framework. Is there material in this chapter you find that is relevant to working with substance use groups based on what you read last week? And whoever would like to start.
Well, I guess I'll start since you can't see me. Um, Actually, when I started reading the chapter, I said, it seemed to me um that their rules for not the rules, but their procedures that they had listed for starting the groups was like I was thinking when I read it, oh, they're giving their group members too much autonomy to choose and select how they want to go to the group or if they're interested in the group. But then as I read further, I understood why that was the case. And it and the reason being that Corey concentrated more on therapeutic groups and as opposed to like the information and tip because when I read it I thought about well it really depends on what stage of recovery the person is in, the client is in, but how would the client know to make that decision which groups or which group he or she should attend, based on, just the information that the therapist gives them. But there's a big difference. The difference to me was that it depends on what stage of recovery the client is in. But with the therapeutic group, it appears as though that's not the case. That the client will have more autonomy to choose which group that they would like to attend, and if they're interested. And if not, then the therapist gives them the option to go to seek another facility.
She's
So
still there.
that's what I came up with, and that was the difference for me. I'm like, oh no, they can't have they can't make that decision. But as I read further, then I understood what the difference was. The difference is, that Corey concentrated more so on a therapeutic group. And then, and like I said, as I read further, the author implied that those terms were not considered for substance abusers. And I said, oh, okay. So that's the difference. And that's what I came up with.
Well, I want to say this. I'm a bit confused because in reading chapter 4, I think it was chapter 4, they
Mhm.
went on to talk about describing the basic framework of formalizing a group. And so as I read on, it was like describe 5 practical concerns in the formation of a group. So it was not so much, which I thank you, Leah, seeing what the therapeutic group was and the substance abuse group. What I got out of what Corey stated is that there's a systematic preparation that is essential when you start to formulate a group. And then he went into the pre-group issues and the screening and having private screening interviews with the potential clients or patients. And so I got out of that, in chapter 4, it went all the way up to from stage 1, which is the pre-group issue, stage 2, initial stage orientation exploration, and then it went into stage 3, the transition stage of dealing with reluctance. So I was just reading about the certain things you have to do to formulate a group. I didn't know that it was a difference between a therapeutic and a substance use group. Anybody have a comment on that?
Yeah, I'll just add that I really like the Corey chapter because I think it really kind of it's practical in the sense of if you are in a group in which you are the leader and
Mm-hmm.
it's for therapeutic groups, I think, then these are the things that you need to consider. This is how you let people know. This is how you help people see if they're going to be a good fit. This is, how
Mhm.
you
Right,
help,
Right.
build up trust. This is,
right,
how you help with problems. I think the
right,
the tips was really kind of it gave a variety of different groups. It covered some of this stuff, but this was kind of, yeah, I found it really helpful.
Yeah, I can speak to that too, Ron. I'm just looking at what some of the things I highlighted, and I like that Yalom said that he contended that clients' level of motivation to work is the most important criteria for inclusion in a therapy group. Members must have a capacity and a willingness to examine their interpersonal behaviors, to self-disclose, to reflect psychologically on themselves and others, and to give and receive feedback, and have some capacity and willingness to engage with other group members. I thought that like this chapter of Corey was, like you said, a lot more about like the actual components of the group compared to Tip, maybe that's
right,
the way to say
right.
it.
Yeah,
Hmm.
And then I
Yeah.
put
yeah,
like, and then to speak what you said, Dolores, I wrote about the foundations of the group, that it was trust, and that Corey states that careful selection of members and efforts to make sure that the group is appropriate for them is very important. And it also the way in which the leader presents the group role to the group. And then it talked a lot about establishing trust, ways of
right.
maintaining trust. So I thought trust was a really important factor in this chapter. And then I also wrote, by bringing conflict out into the open and negative feelings that are listened to non-defensively, there's a good chance that the situation, I keep going back to conflict because that's an area that I'm really trying to learn about, that
Mhm.
feelings can be changed. So those were some of the things I really got out of this chapter.
They also talked
Okay.
about, I'm sorry, did you need to say something,
Go
Lee?
ahead.
Oh,
Yes.
okay. What was it was not fascinating, but they also talk as well as trust. They talked about being direct and open about the limits, the limitations of confidentiality. To be, to have a rational approach on self-disclosure. They talked about informed consent. So those things stood out to me that, as well as trust, you got to be able to let them know about informed consent and what is rational and appropriate disclosure. So that's, in chapter 4, that stood out to me. And it's basically, I've always said this about, when you're in a group setting, I say it's rules. We talked about that. We had the instructor when she came on, and we had a Zoom meeting with her. And I was talking about rules. And you don't want to be that person that would make the patient/client uncomfortable because you have this great set of rules. And I don't know how you would make sure that you're not being overly, what is the word, you not being overly like, this is how this group is going to go, and this that and the other. But at the same time, you want to set boundaries.
Mm-hmm. Yeah,
Well,
definitely.
set some boundaries, but hope that by you setting the boundaries, it would make your group more effective and not have them be turned off by the things you would like for them to go by as far as the guidelines. I think that is like an area that's like you're teeter tottering back and forth with the patient/client. and wanting your group to be effective, where the patients, clients will get something out of it. I think you just have to, after a while, it'll get better as you being a
Yeah,
facilitator,
I
getting,
yeah.
I
And I
think
agree, you
have,
have to set boundaries. You
yeah.
definitely have to set boundaries.
I think that's something that too I keep the more I read. Sorry, Lee, I don't know if I spoke over you.
Oh, it's
The
okay.
more I read, I think it's really interesting, like how important having goals and a format and like a same like to start, like we always say, we start on time and end on time out of respect for everyone. And like to start with the specific goals, and so people every week or however you choose to meet, they show up and
Mhm.
they already can hear that this is how it's going to be, and so then it's kind of like, instead of, like you were saying, Dolores, you don't want to be an authoritarian, but you kind of want to help people to remember that it's their group and they're part of these decisions of what we're doing together. That makes sense,
Yes.
I
Yeah,
think.
Yep.
yeah.
Sure does.
Yeah, and I definitely think, we were talking about building trust and clear rules that are set out at the beginning and then that are followed. It's kind of the framework for safety, where someone feels like, oh, I understand the rules of what's going on here and I know how to play. And that enables at least the first steps into disclosure and vulnerability. And
Hmm.
because if those things aren't clear, um, it can feel kind of like the chaos they're trying to get out of, and
Right.
it can
Mhm.
yeah, it can hamper the very thing they're hoping for.
That's true.
That's true.
Yeah.
So I agree.
I love this thing in Corey about problematic or difficult behaviors. The best way to deal therapeutically with difficult member behaviors is to simply describe what we are observing and let members
Hmm.
know how we are affected by what we see and hear. And I think that's such a helpful way to interact with behaviors that are kind of getting in the group's way or the individual's way of recovery, is to kind of help, you know, them see, and then the kind of appropriate disclosure that shows them how the behavior is affecting you.
And the others in the group, you
Yeah.
know.
And
Yeah.
You know,
active listening. You know what? I see, Joe, I saw that you were getting anxious, or this topic was making you angry. Um, can you tell me what, can you tell me what you're thinking, or tell me what you're feeling, like what we're learning about, motivational
Hmm.
interviewing.
Yeah, I agree.
so so
Because
Patricia,
I'm
oh,
sorry.
go ahead. Go ahead. I'm
No,
sorry.
I was going to say that's a good thing to do because someone else might feel the same way, but they may not verbalize it.
True.
So yeah, so I would definitely do the same thing. I would ask them to discuss, how they feel, what it is, because someone else in the group might have the same feelings. So we can, address it and put it on the table for everyone to hear, basically, in case they were thinking the same thing or feeling a certain type of way and just didn't verbalize it.
Yeah,
And,
and I think Dr. Serena, when we met in our one group, she was talking about the writing reflex and like how we want to tell people, oh, you shouldn't be feeling that way, don't do it. Instead, we restructure how we say it, and we say, oh, I see how you're I noticed that this made you feel, or it appeared that it made you feel this way. Can you explain to me
right,
what you're feeling? And then it takes the work off of us, the onus off of us, because then it puts it back on the person and then they get to respond.
exactly.
So I was going to ask you, Patricia. You said, I can't remember which meeting we had, that you had a client that was disruptive to your group. And so I was just wondering, have you addressed that issue in your group? How is that patient? I don't know if that's, I don't mean to, you know,
It's a
break.
different, no, it's not, there's no confidentiality, and it's a different, totally different, it's beyond just a work client or client therapist relationship. It's bigger than that, and there's a lot more levels of issues going on. So I'm just trying to get as much as I can so I can learn how to navigate it, because it's the most challenging situation I've ever had in my life with dealing with a difficult person.
But from what you learned, have you been able to chip away at it too, or if not verbally address that person, but try to understand the layers that that person has?
How I look at it is the person is not mentally healthy, and so I'm just extending grace to them and hoping that someone else at a higher level will navigate the dysfunction.
Okay, that
Okay.
makes sense. Yeah. And you know
Oh,
what? They talked about that. You would have people that are not suited for a group, but they're in the group. And so, what do you do as a facilitator? How do you let somebody know that this person isn't suited for the group and they're disruptive? How do tell a person kick rocks? I don't mean it like that, but you know, how do
Yeah.
you do that? Do you continue to let that person be disrupted where nobody gets the full um what the full experience, for lack of better words, of what they can get out of the group?
and Dolores,
What do you
that is exactly what happens. It is such a disruption to the whole entire group that you can see people just go blank, like
Yeah,
you just stop listening. I mean, it's a great time to be doing this because I'm learning things, but it's challenging, very
yeah.
challenging.
But Corey did say that there's no really perfect group. He's just gonna, give you, the foundation, but there's no perfect group. So, I guess it comes in time and you learn the people that you
Yeah,
work
like
with.
as you go along, really, because it takes experience and it takes, years to gain that experience.
Yeah, that's
The
true.
more you interact with the group, the more, you get that experience and that confidence to handle
Yes.
different types of groups.
Yeah. Confidence is a big thing for me. Yeah. I want to go in a corner, somebody acting disruptive. I'm like, I would say, oh, this meeting is over with. And I go sit down somewhere and try to think about the next meeting. And I may just continue to say, oh, this meeting is over with. I don't know. It seems to be hard sometimes to understand the natures of different people and how you can, you know, be together as a group and learn something off of each other. Sometimes it's just difficult.
I did take some
What
more
I,
notes that
uh-oh.
speak to what you said, Dolores. I'm sorry, Lee, we have to get your camera back on. I think that's what the problem is we can't tell when you're going to talk because we
It's
keep all of us keep talking
I'm
over
sorry
you.
everyone's interrupting you, Lee. I'm
Yes,
here
That's
sorry.
as
okay.
an
That's
advocate.
okay.
Yes, sorry.
That's okay because you know what? Actually, as we're all talking, I'm still clicking buttons, trying to work it. So that's okay. That's okay. No, but what I was going to say was that when I have encountered people that have disrupted the group or that continues to be like a thorn in the group or whatever, um, aside from calling the police when they get really, really out of hand, that was like my last resort was to call the authorities. But what I have done, and I was fortunate enough where this really, really worked. Um, I pulled the client to the side after the meeting, and I just said, you have one of several options. Either you can stay and follow the guidelines and the rules, and we would really like for you to stay because we really like, your input. We like you being here, yada yada yada. But we can't have that because it disrupts the other clients. And so far,
Okay.
at the time I was fortunate because I haven't, because like I said, I'm retired. But fortunately, that worked. Yeah. So I was just fortunate in that instance. And the people, they were a little edgy, but they did come back to the group, and they did change their mannerisms and their behaviors. So it worked. And sometimes I would punish people, not to be bad,
How would you punish them?
but no, punish. I would
I
punish
know what you
people.
said.
Yeah, how?
Oh, oh, I wouldn't allow them to have so much input. And after the group, I would explain to them why. Because you're being offensive, you're offending the other group members, yada, yada, yada.
Okay.
And
So
I was
you
fortunate. And like
cut
I
them
said,
off.
I'm sorry.
You cut them off, you know.
Yes. So I didn't want
Okay.
to tell them that they could not stay or that they couldn't be there. But at the end of the session, I would, pull that person to the side and tell them why I did not allow them to, be rude to the other group members or, disrupt the group or be intrusive or yeah. So that's why I say I was fortunate, you know, that that method worked. Yeah.
Um, Maybe we can go to the second part here. Is there material in this chapter that you find relevant to working with substance use groups based on what you read last week? And one of the things I thought was really smart was one is kind of the interview process, and then that first group meeting where
Mm-hmm.
it really is it's kind of it's pre-work. It's laying out these are the goals, these are the guidelines, hearing from the group what they're hoping to get out of it, and then kind of giving each member a chance again to affirm their place in the group, or to say, maybe this isn't the right fit. But
Hmm.
I think one of the things I have been week in group leading is kind of setting that up well so that the members kind of understand the expectations and goals. And it takes all of us so much time to remember information, and kind of this is at least maybe the third time they're hearing these, the guidelines, the purpose, getting their feedback, that hopefully by the time the group work starts, there's some real buy-in. Thought that was a really good information and insight.
Ron,
I think so too.
I think I kind of found the same thought, the same value, and I wrote down the roles of the leader to model and set the tone and shape the norm of the group, to help identify goals and get participants involved. And then three, the division of responsibility, balance, style, fostering a collaborative relationship between members and leaders. And I think that's kind of exactly what you just said. I just wrote it down. I just wrote it down like directly from the book. But I think you're absolutely right. I think that structure of the group, and this is what Corey said, structure of the group is important, and the leader must monitor and assess the therapeutic structure throughout the life of the group.
I
Clear and
agree.
concise framework and therapeutic goals tend to foster cohesion, and the willingness of members to take risks. So I think that's exactly what you said. So I agree.
Yeah, I do too. I agree as well.
I do too.
Feeling so affirmed.
Yeah. Then did we have the other part, something about we should also explore how to give feedback, as this is an important aspect of the group? Am I reading something? Wait a minute. I might be looking at in the module. No, never mind, never mind. That was in the module in our group. I have wrote that down.
Never mind.
All right. So did we answer everything? It's such an exciting, just to get understand how to, be a facilitator in the group. I didn't know it was so many mechanisms or things in the background other than you talking and everybody's talking in a group. But group techniques, it's a lot of things to learn. That's what I
I
get.
agree.
Yeah.
I agree.
Yeah.
Okay, so is that everyone? Does anyone have anything else they want to say before I end the recording?
Oh no, I'm good. I don't have anything else to say.
All right.